Hi, everybody. This is a podcast where real doctors discuss fake medical emergencies. That means that unless your hospital's completely out of surgeons, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi, everybody. I'm Jackson Bain.
I'm Johnny Kolasinski. You might remember me from such podcasts as Sci-Fi 5, which is a real podcast that I am writing for from Roddenberry. So check that one out.
Brag.
No joke here. Sorry. This is Hi Everybody, a bad medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. You can find this podcast online at Hi Everybody MD on Facebook, Instagram, and Twitter, or at www.hieverybodymd.com.
You can also talk to us, leave us messages, give us ideas, text us even at 530-DOCTORB. That's 530-DOCTORB. The B stands for, yes, I'm going to use it, Luis Guzman, who is in this episode of Code Black is what we're watching this week.
Should have been for balloons, since they used the same solution twice.
I'm sticking with Luis Guzman. He was very prominent in this episode.
He was. We are discussing Season 1, Episode 2 of Code Black, which is not available on streaming, but if you're a pirate, you can find it on Daily Motion, but don't do that. And we are joined this week by regular guest Dr. Greg Winter.
What's up?
Hi, everybody. What's up? I remembered this time.
And Dr. Scott Herskovitz.
Good evening.
That was better.
Mm-hmm.
Jackson, why are we discussing Season 1, Episode 2 of Code Black?
So a lot of hospitals right now are in a Code Black situation. And for people who don't know what that means, it means the hospital is overloaded, over capacity. Patients are in the hallway, wait times are excessive. You're boarding patients in the ER itself because there's no patient rooms upstairs. This was a big issue in my fellowship. The hospital was pretty much Code Black, probably about 200, 250 days a year. And we would get notifications every night at midnight that they were at Code Black. So considering how all the hospitals are overloaded right now, I thought, let's watch this show that surprisingly was on for 3 seasons.
Is it?
Yeah.
Were you in pediatric only hospital, or was it adults? And
It was adults and peds. And definitely on the adult side, they would be boarding patients for upwards of 40 to 50 hours.
Oh wow.
Yeah, it's much worse now. I mean, in the community, just in Riverside County, it's horrendous. Just being up there, I was like, wow, this is awful.
Yeah, I sort of feel like I don't have much to say because I don't work in the hospital, and both of you do. But I'm gonna say a bunch.
Welcome to my world.
There's plenty to talk about in this episode, I think, in general.
Yeah. Really quick, folks, we've got a lot of new listeners that have been coming on over the last few weeks, so welcome. And best thing you can do if you're enjoying the show is please just tell one friend about it and let them know where to find us.
Also, rate and review us on Apple, because that'll bump us up on the list and give us more visibility.
Yeah, and it's a huge ego boost.
Yes, it is.
Should we maybe say what we do?
Yeah.
Since we do
One more
such
time.
different things.
Or what we are supposed to do.
We're supposed to do. So this is Jackson, so that we can clarify this. I'm a pediatric emergency doctor.
This is Greg. I am a hospice and palliative care physician, so I do patients that are at end of life or have really significant symptoms related to illness.
I am Scott, and I am a pediatric emergency doctor as well.
Yep.
I'm Johnny, and I'm not qualified to be here.
Speaking of crushing egos, that kind of is how this episode starts, I guess.
So the premise of the show is that it's a hospital that was in, and they tell you this in text at the beginning of the episode. It's in Code Black 300 nights a year. And when I was watching it, I thought, oh, wow, that's ludicrous and overinflated. And then apparently it's not.
So this is actually based on a documentary called Code Black, which was based in LA County.
Is it at LA County, USC?
It is LA County,
Kings?
USC.
Oh, yeah.
And they did Code Black based on how crowded and overloaded the emergency department is, wait times going up to 20 hours at moments too. So CBS decided, let's turn this into a drama with Luis Guzman.
I mean, why not? They should do more Luis Guzman.
Yeah, Luis Guzman and everything, as far as I'm concerned.
I agree. I don't know why he wasn't a nurse, doctor, respiratory therapist.
He can do it.
He was the nurse in this one, but he definitely did not act like the nurse.
It's weird because it's like he has a strong personality of like sort of the unit, the
As
nurse
strong as his eyebrow.
of the nursing unit manager who kind of really is a team lead and just has to figure out ways to get stuff done. But also, I've never had a pep talk at any of my jobs other than when I worked at Best Buy. Or maybe I should say, other than when I worked at a big electronics store, which was weird because they would super do pep talks, and that is not a thing in.
Well, that's why Best Buy is still here and Circuit City is gone.
I'm trying to think. Have we ever had pep talks at work?
You
No.
don't start with a morning
Nobody
huddle
has
and this is what's on special today, guys.
Morning huddle.
Yeah, but I mean, I think sometimes we're supposed to be involved with morning huddle, but I'm lazy, and that does
definitely.
not happen because they talk about things that I am less concerned about, and then a pep talk, even in morning huddle, when I've been there, like, come on, some of these things, like, it's not like, hey, Greg, I know you had a rough past couple days, so
Right.
I think I have confidence in you.
No, it's about, hey, these are our patients. These are the things that are pending and going. Kind of here's maybe what's coming up later. It's not. I mean, that was like a cheerleading pep talk.
Yeah.
We do have some like sadness congregations at the end of shifts sometimes where you're just like, it'll get better.
I mean, we have debriefs after codes that are hard, which are
Sure.
kind of like pep talks, but it's more like critiquing at the same
But
time.
like, it's not like you sit back and be like, hey, man, I read When Breath Becomes Air yesterday, and this really applies to the situation that we have. I just want to let you know that philosophically, this situation is like that. I don't know. Like, it's just...
What did he say? Like the first medicine we give to patients
Is oxygen.
You should also use oxygen for yourself or something like that.
Something like that.
Yeah, take 5 seconds and breathe, because that's the first medicine we give patients is oxygen.
As a hospice doctor, I'm just going to say When Breath Becomes Air is a good book. You should read it. It's worth it. I mean, I'm laughing at it too, but
I was hating on that book so hard.
Oh, yeah.
And then I read it and was like, fine.
I mean, it's you get to be a little bit profound when horrible things happen to you. So, I don't know. It's a good book.
I think that's just called America.
I don't think we get to be profound yet.
Not yet.
We're not there.
Now, if you were going to be giving or receiving those pet talks, would it be while you were mopping blood off the floor and changing bloody bed sheets without gloves?
I did not realize they weren't wearing gloves.
No,
either.
it was the end of the scene was glove up. You've got work to do.
Oh.
When this started, we all basically looked at each other like, "What? Like this is not a thing that doctors
No.
do."
Oh, like maybe we could be more helpful, but yeah, that is definitely not something that they're like, hey, Dr. Scott, there's a bedpan that needs cleaning.
There is a janitorial staff.
Yeah.
I mean that's part
I've
of it. Like
never-
the doctors have to go treat other patients.
Yeah, I've never told a resident, hey, there's a big steaming pile in the corner over there. Why don't you go get it?
Yeah.
Maybe we should.
I mean,
No.
that's a different type of pimping.
Hospice is very much team-based approach, so I do help with things like that, like when a patient soils their bed sheets and stuff. But it's not just me doing it. I mean, everyone is helping. It was just a very weird thing, like they're on punishment or something.
Yeah.
That's not the case. No.
It was like a hazing moment.
It
almost.
was.
Or this is before you get to do the real work.
Right.
You've got to clean all the stuff up from yesterday.
And this is an unnecessarily tough residency because they painted that.
Yeah.
They said like half the people, dropped out of this
yeah,
residency?
half the people don't make it. No, they didn't say dropped out. They said didn't make it, implying they got fired due to office politics.
Is that
You don't want to issue a complaint because half the people don't make it through this residency.
so that's really strange because I think the actual statistics are at somewhere around like 10 to 12% of
out.
residents don't make it through. So it's a pretty small percentage of people who don't. I mean, it's not inconsequentially small, but saying 50% of
that would
residents
mean you
don't
have
make
a
it,
really
you
bad
got a
training
problem.
program. Right, exactly.
That means your program
Something
is getting
bad.
shut down.
Like, oh no, we're just this is a tough love residency here. Like, what is this? Did you read too much Ayn Rand or something? Like, come on.
I feel like they all dropped out because they were told to clean up blood.
Yeah.
That'll do it. Yeah, like
Yeah.
I came here to learn medicine, not to
The other thing
clean
that
up blood
I found really
and catch somebody's poop.
Yeah. Oh my God, that happens later too. We'll get there. But the other thing that was insulting was how they were making fun of them for being tired.
Yeah, that's pretty ridiculous. Like, How often do you ask somebody like, "Hey man, how you doing?" "Oh yeah, I'm a little bit tired. I'm kind of like it's been a long day. It's been a long week." Like, who goes like, "Man, that's just weak."
Yeah, I think that used to be it used to be a badge of honor about staying up late and a whole bunch of stuff. But then it turns out it leads to medical mistakes and malpractice. And I think it was when I don't know when you went through residency, but when Jackson and I went through, that's when they implemented the work hour rules.
They implemented it the year after we started.
So we didn't have work hour rules. So I worked 80-hour work weeks more than once. That's like, you shouldn't ever do that. That's not a good thing. It's not helpful.
There was one hospital I worked at, it was 100-hour weeks.
Yeah, that's garbage. You also don't want somebody treating you when they can fall asleep standing up, which is a thing I've done in a surgery in medical school.
100%.
I was appropriately kicked out of the surgery.
Yeah.
Were
you made to sing first or after?
That's a different story, which also happened.
Ooh.
A lot of stuff happened to me in med school.
One day we're going to have an episode, things that happened to Greg in med school.
That's any episode I'm on.
We need to find a show that just has a bunch of medical students and follows them around.
Scrubs Medical School.
Yeah.
What? There's a Scrubs Medical School?
It's the forgotten season that no one wants to talk about because it's not that great.
Oh, then that sounds perfect.
Yeah.
Oh, I don't know if I can. I need a palate cleanser with Face Off after this.
Yeah, we do. We need to retouch on Facebook or Face Off, I think.
Or Nick Cage.
Yeah. Oh, that's when we got to do The Rock.
Oh yeah.
Any day.
Any day.
Yeah.
Oh, that might be one of the greatest movies of all time.
We'll get there. So they said Saturday night it was coming and it was going to be real bad. I don't. Do you think Saturday is the worst night in the ER? I don't either.
I would assume Friday. I know that when I worked in the ERs in residency, Fridays were the ones where like things just got weird.
Surprisingly, volume-wise, it's not.
Yeah, volume-wise, Saturday night's not the worst. I mean, I guess it does depend on the institution that you're at, but I mean, for us, Sundays are pretty horrible.
Sundays and Mondays were usually the worst days.
Horrible. So
I wonder if it's different between adults and kids though too.
Not when I worked at an adult hospital, it was also Sunday and Monday were the worst days.
Okay.
Because
could some of that be staffing though, and you have
it's actually
more doctors and more you have more staff on for no?
No, it isn't. It's because the work week begins on Monday. So a lot of people try to get stuff checked out before they go to work on Monday, or they go to work on Monday and then realize something's wrong and then go to the ER that night. So trauma-wise, probably not the most on Sunday and Monday, probably on Friday and Saturday. But in terms of sick patients, Sunday and Monday are usually the busiest and worst days in the emergency department.
And Fridays and Saturdays, the outpatient physician offices are still open. So for things that can kind of be triaged first and prevented from coming in, they can at least be seen or have a discussion with their physician outpatient versus Sunday that rarely happens.
Mm-hmm.
They all come in.
And Monday, would it be like this escalated on Sunday when we couldn't have seen the doctor sort of situation?
Yeah.
Or I can't go back to work until I get this checked out. Or please don't make me go back to work until I get this checked out.
Yeah, it's more what Greg said. That it's that kind of situation where they go back to work, they start like exerting a little bit and then realize, oh, something's wrong. I got to go to the emergency department. And then you find STEMIs and all that other stuff. So that's when
what's a STEMI?
It's an ST elevation myocardial infarction, which is a heart attack.
Okay.
Yeah, I still remember that stuff because we got to see adults now.
Jackson talks fancy.
I do talk fancy. But that kind of leads into this whole thing where I think this is the most number of patients covered in one episode of a medical show we've covered.
Yeah, there were a lot of them, and a lot of them were just one scene. Where it was
none of them were one scene. They all, except for Nosebleed Guy, that was one scene.
No, it was two because then the father needed reassurance from the ER attending.
Wasn't there like a leg laceration or something that was just one scene?
So I think that lady turned out to be
they call those lax.
Turned out to be lady with belly pain.
Oh, okay.
Yeah, that got really confusing, but
Was that ovarian torsion woman?
that was ovarian torsion woman.
Yeah.
So she initially comes in because she got into a car accident.
Yeah, and it was the same one. You're right.
Yeah,
You're
she
right.
was told she had leg lacerations. For some reason, they were explaining zones on her leg, which I don't think I've ever described legs in zones.
Zones?
Yeah.
I mean, that's a
neck thing. Yeah.
That's a neck thing.
It is a neck thing. Yeah.
I also thought it was weird, like, you know, they sort of set it up where this is going to be a really busy night, blah, blah, blah. And then immediately there's 3 ambulances that pull up at the same time, which is not like ambulances call ahead and they triage where they're going even. It's not.
It depends if it's a base station or not.
But you would know those patients are coming.
You know,
right?
yeah,
you
you're
still
right.
will get a heads up.
It's
You're right.
very different that, like, it's not that. I mean, it's still chaotic and it's tough and stressful. It's just they know who's coming in and
We get rooms ready.
people aren't surprised by the ambulances coming in, or at least very rarely.
Very rarely.
I mean, maybe trying to be somewhat defend them, but maybe this was 20. They're basing it off of 20 years ago.
Oh, yeah. Also, I don't work in an ER, so don't listen to that. That's really important. I'm basing this on my limited experience, and there's 2 ER doctors here. So
Yeah, I mean, maybe it was 20 years ago. You're basing it off of this tale and this kind of nonfiction rendering of an LA County hospital, and maybe then there wasn't that much foresight, there wasn't that much planning, and there wasn't that much communication between EMS and the EDs. But I think EMS and the interaction between emergency departments now it's very well done, and I almost rarely ever see somebody that I'm not aware of that's coming in. The information may be limited, granted,
But they try to close the loop.
but you know someone's coming.
Yeah. But definitely not 3 all at once.
I mean, even if there were 3 all at once, they wouldn't have all rushed. Like, you would have already been broken up. You would have known who's assigned to what. It was just a weird, like,
especially in a car accident situation, like when they consider it like a mass casualty incident.
But those weren't
They
a
weren't.
car accident. Those were all. There were 3 different things that came in.
It was 2 from 1 car accident.
Yeah, I mean, you have it all set up. I mean,
Yeah.
when we literally just had one of these, and it was like you just had 3 rooms, 3 physicians, and you broke it up and had 3 different teams that were just sitting there waiting for it to happen,
Yep.
and you did it.
Yeah. I will say it's pretty fun waiting. You're like, 5 minutes, huh?
That is the best. Hey, what's the ETA? You got to be here in 5 minutes.
Well, if the
30 minutes
patient's
later.
not there in 30
Well,
minutes, the
I'm-
treatment's
I'm
free.
suited up.
Correct. If the patient is not there in 30 minutes, the treatment is free. Though, however, sometimes they'll go like, oh, our ETA is 10 minutes. And then you see the lights coming in. And you're like, come on. No one's ready. No one's gowned up. It's bad.
Well, so maybe that's where like they all show up at once. You're like, oh, hey man, we get all these patients. ETA 10 minutes. Okay, you just called right now.
Yeah.
Right.
You're outside.
You know that you are not 10 minutes away. You're in the ambulance bay.
You
guys.
see them driving around the block 3 times.
Yeah. Oh, we'll be there soon.
Yeah.
So in that scene, we kind of saw, oh my gosh, they said the title of the show.
Yes.
When, I don't know if she was the lead attending.
She's the residency coordinator.
Yep.
The residency coordinator said basically, okay, you're here, you're here, you're here until it's code black, and then, quote, we're free balling it, unquote.
Does that mean like no underwear or?
Yeah.
Whenever I'm
yeah,
wearing scrubs.
I assumed that everything would have been used as tourniquets or something by then.
Maneuverability.
But I assume that even in that sort of high volume situation in an actual ER, it wouldn't be we're going to play it by these rules and then we're just going to make it up as we go.
I mean, some ERs are divided by zones depending on like the acuity of sickness in general. And, you know, sometimes we'll cross other zones to help out if it gets really, really busy. So that could be a situation like that. I couldn't tell how big this ER was. It looked not that big, but also there were lots of people everywhere.
What it looked like was they opened up like, oh, we need to do ER overflow. We're going to open up this area and then we're just going to treat
them in the hall.
Right. It didn't look like a normal ER would look, because a normal ER, you separate patients. You're trying to make sure you're not cross-contaminating things. Granted, it depends on the size of the hospital, but like they were really, really packed in tight.
Yeah, again, maybe this is what it was 20, 30 years ago. I'm just trying to give them some credit. But yeah, I mean, if something like this were to happen, you know, at least for us and for any big emergency department where they create it where it's a zoned environment, if there were multiple traumas or multiple resuscitations going on, what ends up happening is the other people in those lower acuity zones get called over and you're waiting and ready to do those resuscitations while those patients who don't need to be dealt with right then are kind of left to be evaluated later.
They talked about triaging a lot. Like way too much.
Yeah, this is what it would look like if there was a mass casualty event, right? Like
Every day.
Then I would assume that, okay, yeah, you're going to do stuff like that. Otherwise, you try to keep things, you want to keep things calm because when things are calm, they're safe. You you make less mistakes. You're not rushing around.
Yeah, right. Like this is that.
Also,
old,
remember, I don't know what I'm talking about.
I mean, it's controlled chaos, right?
Yeah.
Like that's what everybody kind of describes the ED as. But like to say that there's no plan, I think does a disservice to emergency medicine.
For sure.
Yeah. We always have a plan.
Yeah.
Sometimes the plan changes like 50 times a day, but there's always a plan.
Yeah.
We know what we're doing most of the time.
Yeah.
I think that's the safest way to say it. But let's break down these patients because there are a bunch. So I think the first one would be the lady who came in from the motor vehicle accident with leg lax, scalp lack, and then belly pain later.
The lady who bled.
The lady who bled, who had a scalp laceration, and they told her, oh, it's getting near the carotid artery.
Yeah, there's a problem with that.
Yeah, I mean, you're a hospice doctor, and I think your anatomy may be better than their anatomy, but and that's no disrespect.
It feels disrespectful, but I'll take it.
I'm no surgeon either.
It feels like the carotid is a little bit deeper than what they were dealing with.
Definitely is, yeah.
That was more of a facial laceration, a superficial wound. You're not dealing with the carotid artery.
No. And they were spending a lot of time trying to sew. And granted, the face and the scalp in general are big sources of bleeding, and you can go into shock by losing a lot of blood there. So you want to close it as fast as you can. I mean, they had a former surgeon, now ER doctor, sewing it, which I don't know if it means he sews faster, but that doesn't make any sense.
Also, if there was a carotid laceration, she would have died.
Yeah.
Like they were not moving. You know what? There wasn't enough blood. We haven't said it yet. If it was a carotid laceration, there would be more blood.
Yeah, come on, man. This
also,
is
it would be spraying.
Yes.
Like, if you're worried about that, my first call is, hey, vascular surgery.
Yep.
Hey, homies, I need some help.
Yes, guys that are on call that are waiting for this exact type of emergency. We have one for you.
Yeah.
Please get the OR ready.
Yeah.
They're
Exactly.
stable. We got the leg lack taken care of for now.
Hey, Johnny, did you like how much PPE they all had on?
In that they had short sleeves and they did have gloves.
That might be the only
Once they
thing.
picked up that blood.
Once they picked
Yeah.
up that blood. But like, if you're worried about spray, I would think you would want to wear a mask and maybe goggles, or at least a face mask
face
with
shield?
a shield.
Yeah.
Yeah, I mean, the adult world is so different than ours, where you have these transmissible diseases that can be pretty significant. Like, there's no way in my mind that I'm sitting back and some patient who's just like spurting blood everywhere, like, and you have no history. Like, oh, could they have HIV? Could they have hepatitis? I don't know, but you know what? I don't need gloves.
Yeah,
and I don't need
least
a
I'm doing is putting a
mask.
mask on. The
Yeah.
very least.
Yeah. I mean, I always wore everything.
Even if they don't, it still probably doesn't taste great.
Yeah.
I don't have the right response.
It is less filling though.
Liquid blood sausage.
Wait, okay. So lady comes in, has the laceration, turns out she has ovarian torsion.
Well, they didn't diagnose that right away. They got routine blood. And
We're
they
going to
told
have
her.
to move a little bit faster.
That's true. That's true. We got like 14 patients. this
We
week.
do. But they said she had an elevated lactate, said she had some kind of ischemia, did a CT scan, told that she had ovarian torsion.
Yeah.
Yeah, I did just see that, and a lot of this whole show, I'm like, did you forget how to do a trauma evaluation? Like, did you not ask a history? Did you not, like, most people, like, hey, are you hurting? I don't know.
Right.
Like, I don't distrust families that much.
But also, if your belly hurts and you go through the donut of truth, you're gonna see an ovarian torsion probably too.
You are. Yeah.
You don't need the ultrasound.
I didn't know that.
Yeah, you don't necessarily.
It's not a good way to diagnose ovarian torsion.
It's the like.
but it's a way.
Yeah, if you use that as a way to figure it out, people are gonna make fun of you.
Should you talk about what ovarian torsion is? Because you guys had a whole weird conversation where I was like, I can't believe we're all doctors because I don't know what they're talking about.
That's true. Go for it.
I do know what torsion is, though.
So ovarian torsion.
It's the other parts of the.
So ovarian
The
torsion.
hospice doctor knows what torsion is. Just wanted to make that clear.
Ovaries.
So ovarian torsion basically means when it's twisted, and you cut off the blood supply to the ovaries.
And
And
they kind of explained it in
yeah, they did explain that part. There is a dual blood supply. So sometimes if you do an ultrasound and you see what they described as a rainbow of colors,
There's only two.
Yeah.
it doesn't mean
I had a question about that because they were talking about
So
a rainbow of colors.
it is blue
on
and
a
red.
black and
Yeah.
white.
So what
image.
what an ultrasound can show you is particles moving away or particles moving toward, and
Yep.
it differentiates it with blue and red. And so you can get kind of different shades of it depending on the angle that they're moving away, but it's not a rainbow of colors. You get
blue and red.
blue and red.
And you usually
I
drop.
don't think we've ever actually seen blue and red on an ultrasound on TV.
No.
Yeah, you're probably right.
Yeah. And usually we'll put a Doppler on there.
I hope
too
I'm
and see
not
the
wrong.
leashes. No, you're right.
Oh yeah.
Yeah, you're right. But just because you can see flow doesn't rule out ovarian torsion either,
Oh, okay,
because there's
because
a
of the
dual
dual-
blood
okay.
supply. And the way you get it is you can have a cyst, and it throws the axis of the ovary off, so one side's more lopsided than the other, and that's what causes it to turn.
Oh,
So if
okay.
it turns enough, you cut off the blood supply. So if you have a cyst that's really bad, you have a mass, you have a tumor or something like that, that can actually cause you to get ovarian torsion.
Yeah, and the way they did it also, I mean, this is just being pedantic, but they're
Shallow.
also
Shallow and pedantic.
ridiculous. But they just so they put the ultrasound probe on her belly, and they look and see it at her ovaries, and for the most part, you need fluid. You need a window to be able to see those other organs to actually check this, and they just expect like, oh yeah, that's fine, which I guess okay, fine, maybe it is, just for time's sake, you just do it. But then I don't know, it's everything about this just frustrates me.
It's really hard to see unless their bladder's really, really full. And
Because then there's like a backdrop essentially.
no, so you use the bladder to help transmit sound waves closer to the ovary so you can see it better. Otherwise, you'll have a lot of gas that can be from the bowel. There could be tissue, and it's going to be really hard to differentiate everything. So you use the bladder
But
as a window.
I mean, this would normally be transvaginal, right?
Correct.
Yes.
If you were
Yes.
really worried about
Correct.
torsion, you wouldn't be looking from the outside. You'd be trying to get the picture as close to the objects as you can.
100%.
And that's why
All right, guys, I'm out.
CBS really wanted to do that, though, but they couldn't.
That's CBS All Access.
Yep.
But then they determine she needs surgery, and they try to get the ER doctor who did a surgical residency
Residency,
for
yeah.
a year.
No. He completed it. But when they asked him, have you done OB? He goes, yeah, man, I rotated there once.
Right.
And then the other doctor goes, oh, you can do this then.
Right. They can't find a qualified hospital employed doctor who is an obstetric surgeon to do this, so they're going to have him do it. And so that's what you guys were talking about before, is that there's this kind of time frame window that they
Yeah.
talk about. But I don't know what I'm talking about. So that
Yeah,
I'm
the
trying to get you
situation,
guys to
as
talk
I
about it.
understood it, was that they had, thank heavens, an operating room opened up, but they were all out of surgeons.
Yeah. Yes. So theoretically, you want to get this done as soon as possible. The data is you want to get it done within 6 hours is the highest success rate to save this ovary. But at the same time, they make it sound like, this is a bomb about to go off. Like, I feel like I'm watching an episode of 24 where it's just ticking down, and they're like, oh no, if we don't make the 6 hour mark, her ovary is dead. And so is her chance of ever having a child. And like all we were talking about when we were seeing this was, are there other hospitals in LA County that they could send this patient to?
Yeah.
Can you turn one of the rooms that's enclosed into an OR in the emergency department into an OR room? Yeah, you
There's
can.
so many ways to deal with
Can.
this, and they didn't. And this is a level 1 trauma center.
Yeah.
You need to have these surgeons available within 30 minutes, or if not in-house, actually, depending on the trauma criteria. So you need all of this stuff, and no one wants to do any of it. There's no trauma surgeons in this hospital.
Yeah, they sort of use Code Black as we're short staffed, but that's not what Code Black is. Code Black means we have too many patients.
Yeah.
They have plenty of doctors, and when that happens, you get busier, and it sucks to get busy, but it's not like you don't have your normal staffing.
Yeah.
Otherwise, they'd be like, obstetrics is closed. We can't do any obstetrics.
Yeah.
That's a very different thing.
I don't understand. I'm so lost on why you needed a guy, why you needed the guy from Hillbilly Elegy who spent a month in Appalachia to come out and do the same thing. Like, oh man, I did this once. I got this, guys.
We were saying it takes a certain level of like
Cockiness.
arrogant narcissism to be like, I'm gonna do this elective procedure when I don't have to do it in a non-sterile situation without proper staffing or help. Like that's a real aggressive.
Yeah, he broke sterility like in the first 2 seconds of that operation.
Yeah, and I said this before, man. Like, I am arrogant, and that's a level of arrogance that I'm not gonna cross.
Laparoscopy was my jam, I think was the
Yeah,
exact
yeah.
words he used.
Yep.
Yeah,
And clearly it wasn't, because if I remember anything about laparoscopic surgery, it's that the camera comes out as late as possible so that you can make sure you didn't F anything up on the way out.
Or leave
Like,
something behind.
That is 100, like the camera is almost the last thing to come out, if not the last.
Also, they didn't pin that ovary down, so that thing's going to twist.
That's
again.
going to twist right up.
You didn't pin it down.
Yeah.
yeah. You know,
What do
like
you
in
mean?
wrestling.
Yeah. They didn't hold it down for the 3 count.
Yeah.
Okay.
No, so the reason, like, what torsion is the ovary actually physically twists and it cuts off the blood supply. I mean, I think they even say like a hose, like a kinked hose, which is a good analogy. And so they untwist it, they get blood supply back. But what they don't do is like throw a little stitch in some of that tissue to keep it from twisting again, because otherwise it's going to twist again. I mean, it twisted once, and I think it's more likely to twist again if it's twisted once.
It's the fool me once, shame on you. Fool me twice.
Not
Fool
gonna
man
fool
can't
me.
get fooled again.
I was going to go with it's the headphones phenomenon of if you twisted your headphones cord once, it will be like that forever.
It's forever twisted.
Yeah.
Oh,
You can also have testicular torsion. There's a great episode of Venture Brothers about it. I highly recommend it.
I'll add it to the list.
that sounds good.
It is.
That sounds good.
So
I'm uncomfortable already.
so we got through one patient.
All right,
Let's get to patient number 2, who was also in that car accident.
perfect.
He passes out, and then they said before anything, they go, he has a GCS of 13.
No, he was not in the car accident.
It was
Is
just
this
some
the
random
hockey
dude.
player?
Yo,
No, there
Who
was
we talking
another
about?
guy.
Who we talking about?
Flail chest guy who got intubated.
Oh, yeah.
I don't even remember this guy.
Yeah, I think it was in the car. I
Yeah.
think he was in. This is
Okay.
the dad, right?
Yes, it's the dad.
Yeah.
So
He was in the car. Not the dad with the blind kid.
Yeah, he
Yeah.
came in, and then everyone just goes, he has a GCS of 13 before even asking him any questions. So they were
And
able.
What's
then
a
he was
GCS?
actually answering questions appropriately
Yeah.
before all of a sudden he's like,
Yeah. So GCS is a Glasgow coma scale.
Oh,
So
okay.
it's just to kind of score how deep poop you are in, basically neurologically.
yeah. What's your mental status?
So-
Yeah,
it's
it's
a
come
scale
up before.
of being from being in a coma to being normal, basically, and it's a quick way to assess that in a number scale. And I don't remember, what is it? Less than 8 is bad, or less
Less than 8 intubate.
Oh wow, okay.
Yep.
Remember, I don't know what I'm talking
But
about.
that's but that's the known.
In the hospice world, less than
we don't
less
do a
than
lot of
8 is
intubating.
later.
Well, you seem to be doing pretty well for my patients.
But less than 8 equals intubate. So, but this patient had an GCS of 13, but then he passes out, and the first thing they do is, oh, we better intubate this guy.
Yeah,
And
yeah.
they did.
They did.
And then they said his chest looked weird.
Did he die?
No, he survived at the end of the episode. He got rolled out of the hospital, apparently through
To
the
applause.
emergency department to a round of applause.
And I'm sorry, what? I remember the ER attending, like, seeing the surgeon give bad news down the hallway.
Mhm.
That was the
was
wife.
that?
That was the
That was
wife.
the
That was the wife and kid.
Of who?
Yeah, of that guy.
Of him.
This
But
guy.
he did fine. So why was she all sad? Looking?
Because this was the guy who got.
This show's horrible.
So this is the guy who got his chest cracked open.
Oh, this is the guy that got the ED thoracotomy.
Correct.
Oh, this is the guy that should have been dead automatically.
Correct.
Oh,
So they intubated him, but then they said then he woke up and grabbed someone, which makes no sense on that part.
did he, or was that the?
Nope.
There was
same
a
guy.
lot of
That was
waking
him.
up, and the
So-
bloody nose guy did that.
So he woke up after getting intubated and
Yeah.
grabbed someone and then lied back down. And then they said they couldn't get his sats back up. And then they decided to crack his chest open and do a thoracotomy because he had a flail chest. And then the way she approached it was kind of weird too, because she went
So
pretty.
a thoracotomy.
So otomy just means open up.
and
then-
thoracotomy, or thoracot means the thoracot.
No, thorax means the thorax, so your chest. Jackson,
Yeah, so
come
like,
on.
so like aliens, when the alien pops right out through the person's chest. This is like
That's a
the
spontaneous
doctors
thoracotomy.
actually. That's real.
Yeah.
That's real. But we do that.
So usually you're doing a thoracotomy for rarely ever with blunt trauma. It's usually with penetrating trauma because you're trying to look for a hole to plug, like the episode.
Like
And-
the name of the episode.
Correct. But if someone came in after a car accident, you usually don't do a thoracotomy because there's nothing to stop the bleed or to stop bleeding.
Yeah,
Mhm.
this
It's
is
just generalized diffuse like bruising.
right. Yeah, this is more for penetrating trauma
Correct.
than it is actually for blunt trauma.
Yeah.
Yeah,
But
and the words should be self-explanatory, but blunt meaning
Car accident.
you get hit by an object to the chest, the abdomen somewhere, versus penetrating. That's like a gunshot wound, for example.
Penetrating, like something that penetrates the skin. How about that?
That was Greg Winter.
Good clarification.
So they crack this patient open and immediately say there's no cardiac activity. Let's inject with epinephrine into the cardiac muscle.
Sure.
Rarely happens.
Why not?
And then they massage
dead.
the heart
Yeah.
really badly.
Cardiac massage is literally the last thing you're doing before you're going to pronounce a patient dead, because you are making their heart beat. Instead of doing CPR like from the outside, you are inside their chest cavity, squeezing their heart to make it beat.
And the way they were squeezing was the wrong way to squeeze.
Squeezing is the wrong word to use. You should be like kind of pushing on it
Yeah.
a little bit.
So usually you take
Yeah.
the heart and you push it against the chest wall.
And by usually he means a thing that almost never happens. This is not a common thing.
Yeah,
I know this is an audio medium and me doing this does nothing.
yeah.
Yeah.
Jackson's kind of
raising the roof a
his
little
arm.
bit.
I am raising the roof.
He's slightly raising the roof.
Correct.
The roof is slightly higher than it was moments ago.
But the way they did it was just not the way to go. And then they saved him.
He survived, and he walked out 10 minutes later.
That same night. That's correct.
Yep.
Yes.
Yeah. Because that's
And
how something happens when your chest is cracked open.
That actually might be the most inaccurate thing we've seen from a
That-
They
I
did
think you're
say
right.
it was
Yeah, I think you're
yesterday,
right.
so he had 24 hours to
Yeah,
heal.
24 hours after having your ribs broken open, somebody taking a knife through your whole chest cavity, pushing on
With
your
spreaders
chest
and
with
spreaders.
spreaders, that seems reasonable. I'm not I'm not an ICU doctor.
You know what? I'm
but-
going to say the most inaccurate thing was when they got discharged, they went through the emergency department to get out of the hospital.
We
Well,
saw
it's-
that
it's-
in Good Doctor too during COVID times.
Well, it was code black, Jackson. The rest of the hospital was completely full.
But that would have been the most inaccurate thing I saw was when people get discharged, they walk through my emergency department to get out of the hospital.
All of the other exits were full of patients.
Exactly.
It's code
Exactly.
black.
All right, I think that's enough making fun of that ridiculousness.
I'm trying to see.
Is there any more about
No,
that?
that was it for that one.
It was their second use of a balloon to solve a problem, which is real lazy.
Yeah, can we talk about the first way they solved the
Yes.
problem with the balloon? A mountain climbing accident where a kid
gosh.
was climbing a mountain at 2 a.m. Who,
Blind.
mind you,
He was blind.
He's blind because he had retinal hemorrhages. Clots.
Don't tell blind kids what they can and can't do.
Fine. And
Although-
can do
So
anything.
he's so ableist.
well, here's the other thing. 2 a.m., 10 a.m.
Yeah, the
He's
time,
blind.
Time is irrelevant.
It doesn't matter.
No, they have that drug for people so that
What?
they can sort out time and go to sleep.
The daredevil drug.
They did say that he can see shapes, but also who cares? He's a kid. He's climbing. The thing is,
Mountain shape.
but the thing that matters is the fact that he's a kid who's on blood thinners, which means you shouldn't be doing stuff where you can fall a significant
Fall and land
Whoa,
on
whoa!
rocks.
You just gave Jackson crap for not letting the kid live his life. Let the man climb.
Do you know basically my entire job
Let
is
'em.
stopping my patient's aspirin that they refuse to stop. Like, you're falling every single day. You are covered head to toe in bruises. you're gonna have a brain bleed
Well,
from your aspirin.
He's gonna walk it off. It's fine.
I mean, I don't really understand why he had retinal hemorrhages at 4 years old, and this kid looks like a fully formed man.
Yeah.
who's still on blood thinners.
Yeah.
For what?
I mean,
I don't know.
Also, part of my job is stopping these long-term chronic meds that no one else has addressed. I mean, he probably doesn't need to be on blood thinners anymore.
Maybe he's been on this since 4, and he hasn't seen a doctor since then.
That's entirely
likes the way it
possible.
tastes.
It's easier to get Coumadin than it is to get insurance, for sure.
Oh, that's sad.
But they bring him in because he had a nosebleed. He had like a decent amount of nose bleeding.
But so weren't they climbing at some mountain far away?
Yeah.
So this is again another.
Better get to LA.
This is another issue. Like, so I don't know any mountains that are that close to LA. There are hospitals that can be that
Closer.
you would go to. Like, if you were having a significant hemorrhage, you wouldn't be like, let's say you're I don't know, at Big Bear or Mountain High or something like that. Your first stop wouldn't be like
Big Bear Hospital, actually. That would be your first stop.
Exactly.
They have a hospital
Where should you go? There's a place that's 2 hours away.
Yep, that one.
But it's so close to home.
Like
This is sort of my nightmare scenario. I used to do urgent care, and when people came in with just intractable nosebleeds, like, well, what do you like? Put something in your nose. I hope it stops.
But nobody does anything.
No.
Nosebleeds annoy the crap out of me because people come in with that stuff and they're like, hey, what have you tried? And they're like,
I put ice on his forehead.
nothing.
I remember that.
Ice on the
for
forehead? That was a real
I
thing you
remember that
experienced?
Constantly. Because they believe that if you put ice on the forehead, it will constrict the blood vessels from your brain. So that way you don't bleed from your nose anymore.
Maybe?
Nope.
Man, we need health education real bad.
Yeah. Or they pinch like the bridge of the nose where there's absolutely no way to stop the bleed from there.
You look frustrated.
We're so good at Googling garbage. And you think the first thing that you would Google is like, I don't know what to do, guys. And just Google it. Just Google it. How do I stop a nosebleed?
I don't know what to do, guys. About my nosebleed is the #1 search that comes up.
Was that the most in 2020?
Yes.
Yeah. I think so.
But he has a nosebleed, and then the first thing the lady doctor goes is, I can't figure out how to stop the bleeding. We better intubate.
Yeah,
that patient got intubated.
Seems reasonable.
Yeah. And
But what I don't understand is he hypoxic?
no.
His blood pressure was dropping. Also, a thing they did well in this show is back up what they were saying with the with the monitors that were in the background. Like
Also having monitors in the background.
oh right, also having monitors in the background is a good.
I learned that
They had a couple. They
They did. I know, but that's
Yeah,
like normally
something they did well.
that's not a thing.
Yeah, normally they just. So what I learned from
Or the pulse will be steady, and they're like, this patient is crashing.
Well, that's the thing is, I think they were good at showing the monitor and being like, oh, this patient's their blood oxygen is going down. It's 84, and you'd see the heart rate, and it'd be like 110. Like, you're telling me this patient has hemorrhaged so much
Yeah.
that is oxygen saturation.
that their oxygen saturation is now significantly low, but their heart rate is normal.
Well, blind people don't compensate with their heart rate.
I'm so sorry. I forget
I'm
about
surprised
that.
you
It's
didn't
it's
know.
non-24.
Also, I don't mean that.
Sorry to all blind people.
But can we talk about how they plug said hole?
They plugged said hole. I'm going to see if I remember it correctly. Using a urinary catheter that they just pumped up.
With coffee.
I did not hear that.
Forgot about the coffee.
I did
Didn't
not
they
hear that.
take
Oh
the-
yeah, that's why I
Yep,
was.
you're right.
freaking
Yeah,
out
it was
because,
a bowl of coffee.
So to make sure a urinary catheter stays in, you feed the tube through the urethra, and then you fill up there's like a little balloon on the end so
Yeah.
that you can't pull it out.
Yeah.
So that it sits there properly. So imagine if someone poured hot coffee into your nose. I mean, it's contained, so it's not spilling through your entire. But there's so many other pieces of liquid around they could have used. Why did you pick?
Yeah,
coffee?
didn't they put coffee grounds in there?
I mean, it's one of those things where I think they're trying to show in the ER you have to be flexible and you have to think outside of the box. But that
degrades
that
the
is
balloon.
not.
Yeah, maybe 40 years ago, maybe if I were in rural Antarctica.
If you
Which is
ever
all
need
Antarctica.
a saline syringe, there's one in every ER room. You can grab them. They're there. I don't know why they went with the cup of coffee.
Also, most Foley kits have
Right. It's in the Foley kit.
Yeah, it's there.
There's a balloon.
But there are like less intrusive things that you could have done to stop that as well.
You can put a tampon in.
They also, could have pinched his nose. That was a place to start.
Yeah,
like,
why-
that could have been a thing to start with.
Why start with normal things when you can be
When they can
let's
intubate.
find the most intense thing that we could do?
You guys, let's intubate everyone.
I mean, when you have a hammer in your hand, everything looks like a nail.
We're not surgeons or orthopedic surgeons.
Yeah, but ER docs.
We do. They do like
you
they
do
do
like
like
to-
to intubate.
Yeah,
They do like to
airway
intubate.
seems like it's crumbling.
Oh man, their pulse ox is 91. I better intubate.
But I guess you the one time you don't do it and something bad happens, it's like I'll intubate. It's
Yeah.
fine.
do like
I'd rather err on the side of caution.
I do like to intubate.
Yeah. I always make fun of one of my former co-fellows who we would just joke all the time that if they had an opportunity to intubate, he'd be like, hey, man, fractured ankle, intubate. Just do it. Just do it. We need practice. Like, oh, man.
Love that. I love tubing.
Maybe that's why there's so much litigious medicine going on.
That would be a good segue to the hockey player
Oh, jeez.
with litigious stuff. We
Yeah.
are almost we're 3 patients away from finishing.
All right, we
there's
got
a lot
this.
of
We got
patients.
this.
But this is the third big patient.
It is one. It is one of the bigger patients for sure. He comes in because he was found unconscious at the gym. They told him he had a GCS of 13. Everyone has a GCS of 13.
Yeah. Also, if you're found unconscious, you don't have a GCS of 13.
No.
If you're unresponsive.
And he said he was working out hard. He wanted to leave, and the doctor told him that he has to stay.
Yeah,
And all of us.
specifically, it was we can't let you leave until we've done a basic exam. Basically, saying everyone that walks in has a 72-hour hold.
Yeah, all of us immediately said, "No, you don't."
Yeah, that's not how this works in adults. An adult can go whenever they want.
Yeah, there's one scenario where we can hold you if we feel that you are a safety threat to yourself or other people. We can put you on a psychiatric hold, which is a whole own thing that you have to do, and it's a big deal, and it doesn't happen very much. There is like sort of the common sense of like, hey man, you shouldn't leave, or at least before you leave, let us finish up this testing. And often you can kind of talk people into staying. But if somebody wants to leave, they can leave. There's no like, the hospital is not a prison.
No.
So
Yeah, I think that's a good description for sure.
You should be able. Most patients are reasonable, and you can discuss. I would say 95% of my patients I can convince.
yeah, and
them
I mean,
to stay.
I think there's a lot of fear and a whole bunch of stuff. You're in a scenario where a lot of stuff is out of your control, and that's often a very human response to be like, I'm getting out of here. And reasonable doctors and nurses will convince you to stay, but you definitely do not have to stay there. And when people leave against medical advice, we chart that. Hey, told them to stay, they left, and then when bad things happen and they try to sue you later, you're like, I said very clearly. Right.
That was
Yeah,
a joke during
yeah.
residency that we were going to make buttons that said AMA ask me how.
Oh wow, that's pretty good.
The implication here was that literally anyone who came into the hospital was a risk to themselves because they might be ill or injured, and so had to be kept and examined.
Mm-hmm. There was another thing that they said about anybody with a foreign object can't leave the hospital.
Yeah, that was a different. We'll get to that garbage.
Yeah.
I mean, it fits right now.
Yeah, I mean
That's what she said too.
But I have never kept someone until they pooped out whatever they swallowed.
Yeah, I don't know. Maybe that's some weird LA County thing. I don't know. That's just
Look at you
strange.
giving them the benefit of the doubt.
Yeah, you really like this show.
But but yeah, we've never had to keep someone until they pass their coins. Nor did I have a countdown on the whiteboard of how much money said lady swallowed and then crossed off or subtracted.
I'm going to say that they knew how much she ate, and
Right.
so they were making sure.
Yeah, but you wouldn't know
they
that.
mentioned it.
You wouldn't know.
That's another pretty ballsy call to be like, I can see all the coins in the X-ray. She definitely can't leave until she passes.
It's also
this
pretty-
much amount of money.
No. She was like, "Hey, man, I had $4.37," and it was one of those crazy math problems from back in the day.
Oh, yeah.
There were
And
there were
one of
100
them is not a
coins.
nickel.
Hold on. One of them could have been Canadian money. And we don't know that. And it's pretty ethnocentric of us to assume that this is all American cursed.
I mean, that's the problem is there are things that happen where someone's life is not in immediate danger, and so they can potentially leave the ER. Some of them have to get admitted to the hospital, but people leave with precautions about what's going to happen next. Like, hey, you're going to pass some of these coins.
It's going to
hurt. If you
hurt.
have if you start to have bleeding or something, come back or follow up with your doctor. It to say like you can't leave until everything is figured out. Like we don't figure shit out all the time. Stuff out.
Yeah, it's so paternalistic and so irresponsible that this is one of those
Maybe
things
it's from 20 years ago, huh?
Good. It's very true. Very true. I'm really trying to give it the benefit of the doubt. I'm really trying. But
See, this is why I'm so for Bitcoin.
Because you can't swallow it.
Because you can't
You can swallow your
a
hard wallet,
Bitcoin.
though.
You could.
This brought up like sort of a big TV thing for me. Like if somebody on TV is telling you something about a profession and it's like laying it down like gospel, it's probably not true.
Yeah.
Like cops don't have to tell you that they're cops. Like please know that. That's a thing that people think. You can leave the hospital whenever you want to. It's not a prison.
We'll make you sign something, though.
Yeah, we will try to make you sign something.
They may not sign.
Right.
They might not sign.
I mean,
Yeah, I feel like absolutism is a problem.
Yes.
That should
Always.
If you've
Always
ever
a
taken a
problem.
test in your life, you should probably be scared about absolutes because the right answer in anything in life or most things in life is not yes. That is always the truth.
come over to the Gray. It's nice over here. There's a lot of fun people in the Gray.
You know who's not nice and fun? The doctor.
Way to bring it back.
I know, I try. I'm trying to loop this back. But the doctor with the
Right.
hockey player wants something to be strucken from the record.
Yeah. So what happened was before the doctor
Time out,
showed
Johnny.
up,
I'm sorry.
Uh,
Stricken?
Okay.
It's a New Mexico thing.
removed from the record. So the resident who was a big fan of this hockey player who came in with the having passed out at the gym and took a look at his tongue and determined that he had a seizure because he had bitten his tongue.
Yep.
I mean, that's a pretty aggressive call because it could mean a million other things. What he should have done is look at his pants to see if he had urinated in them, because often when people have seizures, they lose control of their bladder. And that's a better telltale sign than if they would have bitten their tongue. Because
And if this happened at the gym, unless
Someone
this is
would've-
4:00 in the morning, someone would have been like, "Hey, yeah, by the way, that guy was shaking and not responsive." And
Hold on, Scott. It's Saturday in LA. No one's at the gym. They're all partying.
Ugh, very true.
it's LA. Everyone, every gym is filled every time of day.
Come on, man. He was at like Equinox or something like that. you know this guy.
Guy was like, I was trying to get my leg rotation in, and he was shaking on the machine. I couldn't get him on.
I missed 2 sets.
But yeah.
Also, no, you brought this up earlier, Greg. Is like the guy was not post-ictal, meaning he did not act like he just had a seizure.
Right.
Which, like, if you just had a seizure, you're probably not going to be back to your complete normal self within 5 minutes. You're not going to be in the ambulance being like, "Yeah, I'm good, guys. Let me go. I want to go play a hockey game. Put me in, coach."
And that's also it's hard to fake a seizure because of things like this. People try to fake seizures all the time because it's a big deal. And if you're in a situation where you don't know what to do, you sort of have to address it. But there are easy ways to tell. Is this actually a seizure or is this a pseudo seizure? Which is, adults don't really do pseudo seizure. Some of them do, but I feel like it's bigger in peds.
Psychogenic non-epileptic seizure.
That would be the correct term.
Penis.
I'm sorry, what was that?
Penis. I wish they didn't change the acronym into penis.
Yeah. It's PNES is a problematic acronym.
But I'm happy they did. It means somebody has a sense of humor.
But we all know how to. I think the BS monitor for all of us, or the BS detector, pretty high. We can tell when someone's faking a seizure.
Yes.
There's many ways.
The main, one of those main things is somebody who has a seizure and then suddenly is like, yeah, I just had a seizure. That doesn't happen. When you have a seizure, all of your neurons are all firing. Your muscle, if you're having
You get
a
real
motor
tired.
seizure, you get real tired. Your body's working hard. You don't suddenly just snap back to normal. It's like it's same thing when somebody gets knocked out in a movie, and then they like wake up, they're like, all right, put me back in, coach. Like, nah.
No, that's not how that works.
No.
But this patient starts seizing again after his team doctor told him that having seizures shouldn't be on his chart. Told he had parenchymal hemorrhages, all from the concussions, and he was told that he was going to die if he gets another concussion.
Yeah, that's one of those things that kills me about medical shows or medicine in real life. This goes into that absolutism. Like, please stop. Just stop.
Right.
Don't tell somebody like, if this happens again, you will die. It's like the with the cancer patients. Like, I was told I was going to die. I only had 3 months left.
I literally was just going to bring that up. I mean,
come on, man.
We get that all the time, and it really messes with people when that expectation isn't met. And there was no reason to say it in the first place, right?
None.
You could have picked any other way to say that. And I think part of it is doctors are used to having the answers, and then when they don't have an answer, they would rather make something up that sounds good than admit that there's some gray area in it. Come over to the gray. Come on.
But this is the emergency medicine part of things. Is for me, when I think of things, is like, you know what? I'm not committing to anything.
Right.
That ain't happening. You can't get me to commit. Like it's,
are you sure it's cancer? Well, you know what? I'm going to have you talk to the specialist really quick. And then just to make sure.
Are you sure? Likely.
Yeah.
You have 12 hours until you see the neurologist.
No. Yeah.
The one thing the last thing I had a problem with this patient was that why was he just hanging out in the ambulance bay? The seizure patient.
Like at the very end?
Yeah. We can't, no one hangs out in that bay.
That's where everyone goes to smoke.
Yeah. But not patients.
That's what I thought he was going to bust out a cigarette. And the
they were
doctor
gonna
was
become
going to go
friends.
out and be like, yeah, man.
You also can never smoke again or you'll die.
Yeah.
Well, the only other thing that came out with that is when the guy's doctor, whatever the heck, came in there and was like, I need to speak to the doctor. And the resident comes in and goes, who the hell is this? Not going to lie, but I have never cursed at a family member, a patient, pretty much anybody in the hospital, because maybe this isn't Wall Street, but I'll probably get rung up by administration.
Yeah, doctors generally try to be professional, at least some level of professional.
Also, getting assaulted by a patient is unfortunately a very common thing in certain emergency departments too.
This was this resident's second day.
You know what? That's right. This is like their first shift. This is trial by fire for realsies.
Yeah. I would not leave my resident by themselves if it's their first day in the emergency department.
Because you don't know anything. They're just starting residency. They don't know anything.
They're not ready for this.
Yeah, that's true. That's true.
Am I the only one who's sad that doctor wasn't played by Kurt Fuller?
Who dat?
Who that?
He's the guy from Evil and Bloodsport that always plays the dick.
Yeah.
I'm sorry, no holds barred.
I know what you.
Bloodsport.
I'm sorry. I'm sad that I don't recognize his name because he
week.
would have been so perfect, so perfect for that.
Dr. Every Show.
He just looks so smarmy and he looks like he would be saying that type of stuff.
Smarmy, love it.
Okay, we're on the home stretch. It's the final patient.
No, we're not on the home stretch.
No.
I got 10 other things I wrote down.
One last question about this patient in absolutes.
Yeah.
Does that mean that Homer Simpson could have conceivably taken 3 or 4 more cannonballs to the stomach?
Yes, exactly.
Yeah.
You never know. You can't.
I've learned something today, guys.
It's easy to say something like that.
To be fair, before his final cannonball that he dodged, it started rumbling a lot. His belly was real sad.
Maybe he was hungry.
That's true. He was always hungry.
That guy's guitar is talking.
Peter Frampton was real upset
when you
about
think
that.
class rings, think Johnston's.
Yes.
So Johnston's. I really like that episode. I don't know why.
It's a good episode.
I mean,
Homer Simpson
real.
smiling politely.
Yeah, that's true.
Okay, final patient. Some construction worker comes in with neck pain and back pain. The girl doctor says because he was waiting in the waiting room for 10 hours.
The girl doctor is also known as doctor. The doctor says. You don't have to specify gender.
Fine.
I mean,
Skinny doctor, fat doctor.
I don't see gender.
She says it was nothing and wanted to get Percocet and then discharge him home. The fat doctor said that he thinks it's something
no.
else.
Oh, really?
That doesn't make it
That's
better,
what
Jack.
we're going with?
I think you can send those complaints to Jackson.
Uh,
Not good.
but he thinks it's vascular. So rip-roaring chest pain that radiates to the back is one of those things that you hear in buzzwords when we're taking our boards that you should always think of like an aortic dissection or something like that.
Yeah, I would suspect that like because they are so fresh out of med school and boards, like that's what everyone would be thinking.
And
right?
to be fair, she even said that like you're thinking zebras, it's just a horse.
I put that in a presentation once.
That's pretty good.
It is.
Yeah, I get it. I understand that. You have that kind of those two different philosophies there where, is this something that's common or is this something super rare? But I feel like the thing that they love to present, and even in real life, is that there's always little data points that point you to a particular presentation. Like, this is the pain is out of proportion. This
Right.
does just not make sense for a muscular injury.
And actually, I thought they handled this well because the
did.
guy kind of makes a case for it. Like this doesn't make sense for who this person
Right.
is.
Yes.
And I mean, one of the biggest thing about training to become a doctor is learning that the history is what matters, right?
Exactly.
You can have all this data and whatever, but there's a story behind it, and the story behind it is what explains what happens. And so the resident is able to come up with something that makes sense, whereas the answer that the other resident is giving, that the answer that girl doctor is giving, doesn't fit the story.
Correct. Even though she wants it to.
Right.
Yes.
And also like I get lazy, like long day, I would much rather this be musculoskeletal pain than a dissecting aortic
Correct.
aneurysm.
Yeah. No. Yeah.
But that doesn't make it happen.
Yeah.
But the other thing, which I mean, we kind of touched on briefly, and if we want to touch on it, but in this patient, this is an African American man, and you're welcome. But this is an African American man, just like the African American woman who came in with had torsion, and these were the torsion woman they wanted to deal with very, very quickly. But this man, they essentially tried to downplay very, very, very much. And I think this is something that I don't think the show was going for this, but I think in real life,
It happens.
It's something that we like really have to be cognizant of, because in this show, again, if they didn't do it on purpose, okay. But they did a good job of describing how things actually happen in real life, where you're like, this is fine.
Yep.
Kind of blows it off.
It's I am from a mixed family. I am half black and half white, and so there are these things that come up where when I try to explain them in a medical setting, people like don't even believe what I'm saying. And it's one of those things, like to this day, there are still studies where the physicians that treat you think that based on the color of your skin, you have different pain tolerance.
Yep.
Like that's a real thing. A lady just died not so long.
Yeah,
physician
a
just died not
doctor.
so long ago.
She was a doctor.
Yeah. And I mean, so that's real stuff.
The
That's
bias
happening.
is still there.
Yeah.
A lot of
I also don't think the show is going for that. I don't think the show's smart enough to go for it.
No, because they had that patient going quote unquote sideways in the CT scan and then having the worst seizures I've seen on TV.
By worse, you don't mean this is the most severe seizure I've seen on TV, do you?
No.
No, I do not. But they
You
also
mean that looked awful.
that looked awful, and they also tried to put a central line in the CT scanner.
Yeah, there was a lot wrong with this patient. If you really thought that this patient was having a dissection, it's not something that you would sit and wait
Yeah.
to sort out.
This is
And that's something that the again, I'm forgetting her title, the boss doctor,
Yeah.
Yep.
the lead of training or whatever, said, like, in not a great way of, if your instincts say one thing, you can't wait for a scalpel or a machine.
You kind of.
I mean, you have to wait for something.
I'm
You
also
can't-
gonna say you kind of need a scalpel to do the central line.
Yeah.
I
think
basically
what she's
saying
saying-
trust. She was saying trust
Yeah.
your gut rather than going for the
And actually-
diagnostics.
They talked to Luis Guzman in his pep talk, kind of talked a little bit about it, where it's, you are part of a team, and your job will be easier if you're in a collaborative environment instead of one where things are getting shut down. I mean, like, it's okay to be wrong,
Yeah.
but I think I think residents don't feel that, right? You are constantly challenged on what do you know, what is this thing, what do you do next, and you are often ridiculed if you don't have the right answer. But actually, critical thinking is important, and you're going to be wrong some of those times because you got to gather data and figure things out.
Right.
And that's.
But that's training. I mean, I
That-
think
but
like
that's where they're
that's
in. They're in
training,
training.
You
right?
need to see those
you're-
numbers.
The whole point is like we're not necessarily teaching you facts. The whole point is like we're teaching you how to think through all that information you have.
It's like a super weird job. You can't book study it. You have look at all the crazy stuff that's happening.
Yeah, you're the one who especially in the emergency department, right? Undifferentiated whatever, you figure out what's going on.
Yeah.
Could it be something crazy? Absolutely.
You're the first one to figure out what the hell is going on. Basically.
Yeah. And that means sometimes that we do more than we should,
Yeah.
or sometimes we do less than we should.
Yeah. We're always working on some kind of hypothesis, and then someone else verifies if we're right or wrong.
Yeah, they get to be the heroes.
Right.
Yeah.
I remember this lady came into urgent care once, and her kid was having trouble breathing. It was fine. I gave him asthma treatments, and then they came in the next day and brought wine to the other doctor because that's their primary doctor that they saw. And I was just like,
Where's my thing?
Wow.
You got
I
burned.
mean, it's fine.
You got the satisfaction of a job well done.
I mean, they were happy. You know what? Their happiness.
Can't get drunk off satisfaction.
Their happiness was the friends we made along the way.
Wow.
Okay. The last thing I just want to mention about this is the ultrasound doing the pericardiocentesis.
Yep. Go
So
for it.
pericardiocentesis is basically when you put a needle into their heart to drain the fluid around the heart. Did they explain how he got a pericardiocentesis?
No.
Or sorry, cardiac tamponade?
No.
No, he just went from his aorta was dissecting to he has a pocket of blood around his heart.
Yep.
Yep. The ultrasound, when you do a needle introducing into the heart, never looks that clear.
No, they made that look real nice.
You couldn't miss it.
Like,
Normally, ultrasound is just weird blood. It looks like a Rorschach test. You really have to do it a lot to.
Can't you tell that gray
interpret
fuzz
what
looks
you're
like that
doing.
gray fuzz?
yeah,
That
no.
gray fuzz is gray fuzz.
Yeah, like if ultrasound was that clear, man, like my
I would
mom
be an
could do
ultrasound
that.
tech.
Is a cardiac
Way less
tamponade
medical debt.
as common in real life as it is on this podcast?
It is very rare. I think I've only done one pericardiocentesis in my entire career.
This is the third episode where that term has come up.
Yeah,
Yeah.
I'm gonna go with no
It's
for me.
It's super, super rare. I've done one. It's super scary.
Like so I think the differentiation though is how many times have you seen pericardial tamponade where you've actually had physiologic changes where you have to intervene
That's the difference.
emergently?
I'm sorry, Padme Amidala died.
Of a broken heart. That's different.
Wow, she had Takasubos.
Yeah, that's actually what we said.
But no, I mean, you definitely see people with pericardial effusions, and maybe they have some mild physiology. But there are Jackson is more privileged than I am. I don't think I've ever had to emergently do a pericardiocentesis, stick a needle in the space between the heart and the area around the heart to save their life. I mean, man, that is maybe an adult. I don't know. Maybe in Chicago. Maybe on Chicago Med. I don't know.
We'll find that out soon.
It's all those kielbasa, man.
No, it's Polish sausage. Come on. Sausage. Okay. But I mean, that was a lot of patients we just covered. I don't know if anyone else has other things to touch on. Greg? I mean, that was a lot of patients.
I think one of the things that was frustrating was when the attending and the resident had this very intense personal conversation just in the middle of the ER. Like, that's...
You mean where she was like, "You don't know me,"
Right.
and then she walked away?
Yeah. That was real TV drama-y.
Like this is where with these medical shows, like I don't understand is there's enough drama to go
Right.
around.
Yeah.
Exactly.
You don't have to trump it up to have this like, yeah, I lost a child once too. Don't talk to me about this.
But yeah, this one, I think when we watched it, there was a lot of anger pretty quickly.
Yeah, you were texting me about it and saying there's so much anger, and I thought you meant on the television, but
There's a
no, you
lot
meant
of-
between the three
was a-
doctors that were in the room.
There was a lot of yelling.
You know what I was surprised about this episode? there was not enough sexual tension. There was only that one moment where the two doctors were like making flirty eyes and being like, "Hey, baby,"
Right.
and then all of a sudden it
surgeon?
stopped. I thought they were just gonna like get it on in the surgical suite. I mean,
Not a surgeon
what's up?
not a surgeon and ovary saver.
Yeah.
We have no idea what the characters' names are.
Yeah. Normally, I've got notes on this, and I did take them, and I still have no idea what
There was
character
too many
is
people
who.
in that emergency department to really keep track.
You know, there was only one person that mattered.
And it was Luis Guzman.
You got it.
Exactly.
Also, I want to see being Luis Guzman in the style of being John
Oh,
Malkovich.
wow. Yeah, that would be great.
Oh,
Nah.
Guzman.
I just want to go watch back and go see the Count of Monte Cristo again. He's pretty fantastic.
Oh my god.
He's just pretty fantastic overall.
Yep.
I want to say something that I think the show did right. And I want to find out if I'm wrong in this. I feel like it did better than Scrubs in as things were happening. The attendings and the fellows were saying, "This is what I'm doing, and here's why."
Oh, Johnny,
Here's what
I
to be
wrote that
looking
down
for.
as a thing that showed good medicine because this is a teaching hospital, right? In fact, it's such a teaching hospital that the trauma bays have viewing windows from above. Don't want to get into that. But that's like in a teaching setting, if you're going to show someone how to do something, you have to explain what you're doing. And also when this is happening in real life, a good attending is telling you about risks of a procedure, about possible complications, about things to look out for. Like, also in the same like good attendings are great because they are doing all that stuff and they're also doing the thing that they're showing you while, I mean, you know, life and death is potentially in the balance.
I'm gonna point at my teaching award.
I refuse to acknowledge Jackson's teaching award.
Kudos.
But that is a really important part of what medicine is. Like you study a lot of stuff, but that also doesn't mean it doesn't mean you can perform during that time. And it also definitely doesn't mean you can explain it and teach during the time that it's happening too. So I thought that was a really good thing that they did.
Yeah, I'll agree with that.
Yeah.
Dr. Cox teaches JD a lot about how to live life, but not a lot out of like in the rooms itself. It feels like in comparison.
No, he pimps everybody.
Yeah, I mean he's old school.
Yes.
That philosophy about teaching is
It's gone by the wayside.
yeah.
For those who didn't hear season 1, what is pimping?
Put in my place. So it's basically asking questions out of the blue sometimes and trying to get your resident or learnee to answer it quickly.
I think the goal, like, as a resident, you're trying to show everything that you know, and I think pimping started as a way to test someone's knowledge, but it really became a way to show that you know more than that resident. Like, I'm the attending.
Lightning round.
I will get you to a point where you don't know an answer, and that's not a helpful way to teach.
Yeah,
right?
it's a kind of hierarchical.
Yeah.
It's a very bean dad way of teaching medicine.
Bean dad.
Oh yeah. Good reference. That guy's a total d-bag.
oh, I do know Bean Dad now. That just happened.
Yeah,
We're
Ken
very-
Jennings. That
We're
man
very
is,
topical.
yeah,
right
yeah.
now.
Never gonna be on Jeopardy ever again. LeVar Barton, baby. Barton.
Oh, I hope so.
I can't wait until the episode where I play against Ken Jennings comes out.
All right. So with that, guys, I do have an important question to ask.
Yep.
The human centipede bills itself as 100% medically accurate.
Mm.
If that's the case, and if that's our baseline, how medically accurate is season 1, episode 2 of Code Black, We Plug Holes?
I can go because I have a formulated answer, I guess.
Yeah.
I think there's a lot of stuff to nitpick about this, but it feels more accurate. There's a lot of dumb things that happen that could have been solved with a better medical consultant. If anybody needs one, I will help.
This whole podcast
Right.
will help.
Yep.
530 Doctor.
But also, like Scott was saying, if you look at this as like a piece in time, like, there's a lot of stuff that probably would have happened in a similar fashion. So I would say, I mean, it's definitely more accurate than Human Centipede. I would say maybe 173, I'm going to say, just to be annoying.
So high.
Wow.
I'm going the
Because Human Centipede isn't medically accurate.
That's a lie.
I mean, it's kind of. But is it 100% medically accurate?
It's
No.
our baseline, though.
Right, which I understand.
Yeah.
I understand the rating system. I do it.
Now you get it.
Yeah.
Took a little time there, though. I'm going to go low, only because there were a lot of things that were so dramatic that it kind of made things.
Also, I don't work in the ER, so.
That's true. Having a ER resident who is unsupervised.
Which, I'm sorry, who is uncircumcised? Is that what you were about to say?
Unsupervised.
Very, very common these
Very
days.
Now that is a callback.
No, that's a callback. But having an ER resident who was a surgeon doing surgery without privileges, no one wearing PPE, doing very outlandish things really quickly and not in an unsafe way, that stuff kind of adds up a little bit. And that makes me feel like it's a little less accurate than Human Centipede.
You're right. The drama part of it is nonsense, but the medical parts of it feel pretty good.
Yeah, I mean, I think
80%.
I'm gonna exclude that surgeon. I mean,
Yeah.
that emergency medicine resident going to surgery. If you exclude that, I'd probably give it a 103. But if you include that, it might be close to 0 because they're not just medical legally, but from a standpoint of your experience, I don't care who it is. You know, if there's a psychiatrist who's like, yeah, I did a year of residency in surgery, you know, you're not going to do surgery. That whole scenario was absolutely ridiculous. But I think despite that, I'll give it to you. I agree with you. I agree that it was, I think for the most part, medically accurate with a bit of over dramatization.
Give me a number.
With the fact that there was a hobbyist surgeon that happened to be there.
I'll go 103. 103.
That's pretty good.
I feel like more than other medical dramas we've watched, this show meant well.
Yeah.
Oh yeah.
Like it wasn't trying to, like Scott said, there was nobody making out in a utility closet. There was no,
Like Scott
give me
said,
your
there's
gun
enough-
and your
there's
badge
enough
moment.
drama that's happening. Like,
Yeah.
you don't need to add weird personal stories.
I will say it's not like when we watched Chicago Med, it felt real cynical.
Yeah,
right?
this felt more real. That they were just there was so much going on. They were trying to deal with all the patients that were there, and they were trying to do the best that they could for the patients, and leaving out some of the personal, dramatic garbage that you see in a lot of these medical TV shows to try and make it more interesting.
We still
Which is why it only made it 3 seasons.
Yes.
Only 3 of
We-
32 episodes each.
We also still have not touched on like the holy grail of dramatic medical shows yet.
What's that?
Grey's Anatomy.
Wait, have you touched on
We have not done either.
Why haven't we done nurses?
Oh, we are.
Because
I have.
Are you sure you want to touch that
Yeah,
one?
I'm not. I will not be present for that. I love all of my nurses equally.
I have
and they're
some,
all my favorite.
They are the greatest.
I have some friends that are willing to do this one.
Nurse friends?
Yep.
Oh, okay.
Oh, then I'd like to be there.
Yeah.
this is going to be the first one where we have a live audience, and it's just going to be all the doctors that have been on the show previously that don't want to talk about the show Nurses,
I will never
but want to
talk
hear
shit
what
about
nurses have to
Nurses.
say.
Never.
I will never talk shit on nurses.
Nope.
I will say that when I did my fellowship, I had a patient who used to work in Denver's public health clinic or public health hospital, which I cannot remember what it's called. I wrote it down. Denver General Hospital, and there's a book called The Knife and Gun Club, which basically like follows people through a day at Denver General. It's an excellent book. It's on eBay. It's like $11. It's totally worth it if this is something that you're interested in and to see sort of what it's like to be kind of thrown into just anything can happen sort of
Chaos.
chaos.
Yeah.
Link in the show notes because I'm going to buy that, and it sounds fantastic.
Yeah. And I would also say that the Trauma Bay did have enough blood in it.
Until they mopped it up.
I mean, that was...
The Trauma Bay did. The person who cut her face didn't. But yeah.
Is there anything you would change to make the show more medically accurate while keeping the dramatic stakes high, other than doctor who probably would not have been a doctor.
Fire the surgeon in the next episode.
Yeah.
Or actually bring him up to like the medical legal board. Like you let him do surgery. He's not like boarded to do all that stuff.
Yeah, I think the
Drama.
I think the biggest thing for me is more so the reality of just because your hospital is overwhelmed. I think Greg said this before. Is there are subspecialists that are on call, and when you call them to come in for consultations, they come in. And if for some reason your operating rooms are overcapacitated, or you don't have staff, or they're down for whatever reason, then the answer isn't let's do some unlicensed surgery. The medically accurate answer is then we need to transfer them to a facility that has the ability to treat the patient.
I would agree.
I'm trying to figure out what city would be a accurate, okay, this is a ICU an emergency room that would be this intense all the time and also would have no other hospitals around it.
So think
like-
about rural states.
Yeah, like Des Moines.
Even like El Paso to a certain extent, because yes, they're a big city, but they might not have
Texas
all the
is huge.
resources. Yeah, so they would send them to other places in Texas or even New Mexico, because that was an issue that we had, where there were people that were sick in El Paso that would get sent to New Mexico. And that is not like a short trip. That is a several-hour helicopter ride or even fixed wing, like at least 1 to 2 hours. So there are situations where that is an issue, but definitely not in LA County.
And they would do that before saying, okay, you're in, kid, as far as surgery goes.
100%.
Yeah. Yes.
They cover this better on True Stories in the ER or Untold Stories of the ER. There's always transfers.
Yeah.
Because every single ER doctor on that show works in the boonies. Yeah. Every single one. I hate that show. I can figure out the answer like 5 minutes in. I'm like, it's obviously this.
You know, Johnny, the other thing that I actually liked, speaking about the teaching point of it, is that, you know, the guy does that surgery, and as unrealistic as the situation was to do it right, part of that is he hands over the controls to someone who has not done it, which is how you are going to show somebody something. And then when something went wrong, he wasn't like, what did you do? Oh no. He was like, nope, don't worry. It's my fault. I must have done something. Those are sort of the hallmarks of good teaching and good medicine, where it's, you know, you are in a team setting, and if you are the responsible person, he is the surgeon, then it's his responsibility. No matter what goes wrong, it's his responsibility, even if he made a bad call letting somebody do something.
Yeah, surprisingly good. I think leadership and teamwork, because even in that part, you know, he doesn't say it explicitly. There's that openness to allow for other communication and thought, and when the other person was like, "Hey, let's plug another hole," you know, he was like, "That sounds like a good plug-in idea."
He said the name of the episode.
They worked in the episode a few times. Huh?
Yeah, they sure did. Yeah, this was an episode of television.
Yeah.
What is that called? The pseudo seizure.
PNS.
PNS.
PNES. Pseudogenic non-epileptic seizure.
Okay. There's one other thing.
Or psychogenic. Sorry.
There's another thing that makes me really happy, that like lets me know that scientists have a sense of humor. Everybody knows about a murder of crows, right? Mm-hmm. Do you know what a group of flamingos is called?
Oh, I knew this.
A flamboyance of
knew
flamingos.
And that's right? Oh wow!
I mean, you gotta be happy
I totally
with
didn't
that.
know that.
Yeah,
you gotta be happy with that.
Flamboyant.
That's actually the name of the last book in the Game of Thrones series.
Flamboyant of flamingos.
I can't wait for that one.
Oh, it's gonna be so good.
Yeah.
It's all set in Dorne.
All right, that was pretty good.
Wow.
That's a good place to end this.
All right, yeah. Thanks, folks, for listening. Thank you, Scott and Greg, for joining us. And we will be back next week with more Hi, Everybody, a Bad Medicine podcast.
Thanks, everybody.